Along those lines, I know that they need more supply, more support, and teammates to assist them in to make sure getting possible that care workers need. That includes protective equipment. It includes testing equipment. It includes masks. It includes gloves. Everything our healthcare workers could possibly need. That task force is working across the entire globe in search of those supplies, working along to try to obtain more of those supplies. Now, my fellow Texans, and that is in times like this, our fellow Texans always supply exactly what we're as it concerns the of our health COVID-19. So many offer support. Others have shared their medical services to help able to tools and resources to respond to us. If others of you who want to assist in any way possible, could be by supplies or offering other medical expertise to assist in responding, go to www.texas.gov. That's www.tes.gov. Go to that site, you'll see a red banner on there that you can click on where you can find the location where you can volunteer supplies or volunteer your efforts to respond to the coronavirus. In addition to thanking those in the I also want to thank our fellow Texans. I want to what you have been doing over the past 1 to 2 weeks to make sure we achieve our collective goal in the United States to slow the spread of the coronavirus. Your efforts to stay at home, to slow the spread, reducing personal interactions is truly saving lives. Health across the entire state of Texas, and it's doing it for thousands of people. The fact of the matter is, it's impossible to calculate the reduction of the spread of COVID-19, but know this. What you've done over the past week to 10 days is very real in the spread of COVID-19 in Texas. Listen, I've seen the photos, I've seen the videos, and as I've traveled in my limited travel, I've seen it personally, in which sidewalks are empty, the streets are empty, the parking lots are empty. Places that used to be bustling, not. And what that means is that there is less communication from one another that could spread COVID-19. The bottom line is you have made a difference, and we are to continue doing so. Now listen, by your efforts, you are accelerating the timetable when businesses will be bustling due to reduce this 19 now. The sooner that we all will be able to return to business as usual. Now, one thing that we are keeping on and that we are increasing is collection and testing capabilities for those who may have COVID-19. There are, broadly speaking, 3 different types of groups administering the testing. One is public health. It could be the Department of State Health Services, or it could be the local public health authorities. Another is FEMA provided a massive amount of both collection and testing capabilities, especially in the larger urban areas. And some of these have been set up through these drive-through testing. And then, of course, there are the private providers and the private labs. The private providers could be your own primary physician or any other physician that you see at a private level. And then there are a lot of private labs that are involved in the process of this testing. Through all of it, I'm proud to tell you that over the past week, we have increased collection and testing by more than 1,000%. Here are the recent numbers that I have as of earlier today, understanding that because testing is going on throughout the entire day, these numbers may be changing a little bit over the course of just today. But the last numbers I have from earlier today is that 25,483 Texans have been tested for whether or not they have COVID-19. Of those tested, 2,552 are confirmed positive for COVID-19. There are now 118 counties in the state of Texas where there has been somebody tested positive for COVID-19. There are 176 people in hospitals who are patients in hospitals who have tested positive for COVID-19. And there are 34 fatalities that have a connection to COVID-19. And when I say connection to, understand this, and that is these are people who may have COVID-19 but may also have a host of other medical ailments, and they have medical ailments and happen to also have contracted COVID-19. Let me give you some very important information that you need to know about these numbers that I just gave you. On average, less than 10% of the people who were tested for COVID-19 test positive. Another way to say that is about 90% of the people who are tested for COVID-19 test negative, which means they do not have COVID-19. Similarly, of the people who are tested, less than 10% of the people who test positive are going to hospitals. What that means on the flip side is about 90% of the people who test positive for COVID-19 are not needing to go to a hospital. Now, most of these numbers that we've seen so far are the result of personal interactions before the distancing practices that went into place either through my executive order or through local city and county orders that began either last week or even earlier this week. So hopefully the numbers that we're seeing may improve in the weeks ahead, even with increased testing. Another priority that we're focused on in the state of Texas that I know many of you have interest in and maybe some concerns about, especially as you see what's going on in places like New York and some other places in the country, and that is the capability of our hospitals to meet the potential demands that we may face in the coming weeks and months if there is a dramatic increase in the number of people who test positive for COVID-19. So let me share with you some numbers. We did an analysis about hospital beds that were available across the entire state of Texas. And the number of hospital beds available for COVID-19 positive patients more than doubled in the past week. Looking back on March the 18th, there were a little bit more than 8,100 hospital beds available for COVID-19 patients. As of March the 26th, there were more than 16,000 beds available for COVID-19 patients. And understand this also, most of that new capacity came online after I issued an executive order that was issued to end elective surgeries in the state of Texas. Importantly, that increased capacity does not include increased potential occupancy of rooms as a result of my other executive order requiring the doubling of beds in rooms that are capable of having 2 beds as opposed to 1. So what this means is that the number of available beds in rooms for people who may test positive for COVID-19 should be even larger than the number that I provided to you today. Know that this is something that we are monitoring on a daily basis. We will continue to provide you information because I know you want to know about the availability of hospital beds in your particular region, and we are measuring that also because we want to make sure we have capacity in the state of Texas to take care of the medical and hospital needs of everyone who may test positive for COVID-19 who needs to go to a hospital. Importantly, though, understand this. The number of Texans hospitalized with a connection to COVID-19 is less than 2% of available hospital room capacity. Stated otherwise, as of today, we have a COVID hospital vacancy rate of 98%. And so that shows that as of today, we have plenty of hospital capacity to respond to the needs of our communities for COVID-19 today. But here's the deal. Two things about it. One is those numbers are the average numbers for the state of Texas, and availability in one community may be greater than it could be in another community. And that brings me to one of my key points today. And that is, our job is not to simply make assessments of where we are today and be satisfied with that. Instead, our job is to make sure that we're looking 1, 2, 3, and 4 weeks ahead and make sure that Texas is going to be prepared to meet the needs of your communities if COVID-19 continues to increase across the state of Texas. As a result, for weeks now, we've been engaged in strategies to figure out ways that we can begin the expansion of healthcare facilities to make sure we will be capable of accommodating the needs of all Texans who may contract COVID-19. Very importantly, along those lines, existing hospitals will continue to be the primary location to treat and care for those in need. But we must prepare for the worst case challenges as they arise. To begin that process, I deployed the National Guard Task Force brigades to assist with healthcare infrastructure in Texas. That includes General Tracy Norris, the general in charge of the National Guard here in the state of Texas, and myself. We have both been working with Brigadier General Paul Owen of the U.S. Army Corps of Engineers. Their teams have been working to identify locations that could be used if current hospital capacity is exhausted. They looked at various different things, including recently closed hospitals or other pre-existing healthcare facilities. They looked at things like convention centers and arenas. And they have looked at hotels that are vacant now because people are not staying in hotels right now. The type of facility that will be needed will largely depend upon a certain region's unique needs, as well as what facilities are available in that particular region. So for us to stay ahead in this process to make sure that your needs are going to be met, today we are announcing the first of these new facilities, and based upon the consultation and advice of the assessment of facilities that are available, but also consultation and advice with the U.S. Army Corps of Engineers about which location in which it is most needed. So given what we have seen about the current spread and escalation of the spread of COVID-19 in the Dallas-Fort Worth area, the location that we are announcing today is the Kay Bailey Hutchinson Convention Center in Dallas, which will be set up to expand healthcare facilities. There are pictures of this over here, which probably are kind of hard for you all to see. But what it shows you is that as we gather today in the Kay Bailey Hutchinson Convention Center in Dallas, Texas, there are already very large-scale medical kits and equipment that exist in that convention center, that all that is needed to be done to be able to make sure bed space is available there is for those kits to be set up. So right now there's the capacity in Kay Bailey Hutchinson Convention Center for 250 beds, with plenty of room to massively expand that number if that is needed. But understand this also, that if we do have a massive increase in the number of people who are contracting positive with COVID-19 who need hospitalization, we have the ability to go to other locations in the Dallas region. But understand this also. As we gather today and speak to you today, the state is working with the Army Corps of Engineers to locate additional potential facilities both in the Dallas-Fort Worth area as well as other regions where COVID-19 is spread the highest here in the state of Texas. So yes, we will be looking at locations in places like Houston and San Antonio and Austin and the Rio Grande Valley, El Paso, in every part of the state of Texas where this need may need to be called upon sometime in the near future. But I want to reiterate a couple of things. We urge local leaders and owners of facilities to contact us if you are aware of structures or facilities that could serve as temporary healthcare facilities. If you have such information, if you would share it at that same website, which is www.texas.gov. That's www.texas.gov. And I want to reiterate that hospitals will continue to remain the primary location for care. Patients with acute needs will be prioritized and cared for at hospitals. Now, I'm going to provide the opportunity for the generals to speak more upon that here shortly. But before we get to that, I will be issuing some additional executive orders today. The first executive order concerns travel. Understand that executive orders that I issue about travel is keenly focused on one main goal, and that is to reduce importing COVID-19 into the state of Texas. The best way to do that is to do all that we can to restrict travel into Texas from areas that have a high rate of COVID-19. One of those areas is our neighbor in Louisiana. It's well known, well documented about the massive amount of COVID-19, not just now in New Orleans, but spreading out across the state of Louisiana. Well, my prior executive order about travel from New Orleans covered air travel from New Orleans into the state of Texas. Now I am updating that executive order to also include travel by road. And it's travel by road from any location in the state of Louisiana. Importantly, this executive order does not apply to travel related to commercial activity, military service, emergency response, health response, or critical infrastructure functions. This order will be enforced like the order that I issued previously about travel from New Orleans. It will be enforced by the Texas Department of Public Safety at and near entry points from Louisiana. Everyone stopped by the Texas Department of Public Safety will follow the very same self-quarantine procedures in the pre-existing order. So that's it for travel from Louisiana. Now, as we all know, since my last executive order that put self-quarantine centers into place for those traveling by air from New Orleans to Texas, since that time there has been an increase in the number of hotspots identified across the country. Hotspots where it would be equally dangerous for people to be traveling into Texas from those hotspots. So, in part in consultation with Dr. Hellerstedt, who is the chief medical doctor in charge of this particular operation and in charge of the State Department of State Health Services, but also in part based upon the doctor in charge of the White House Task Force in response to the coronavirus, Dr. Deborah Birx. We are expanding the executive order requiring quarantine of passengers flying into Texas to include more departure locations. They include Miami, that would be Miami, Florida, Atlanta, Georgia, Detroit, Michigan, Chicago, Illinois, as well as any air travel from the states of California and Washington State. In addition to the executive order or orders concerning enhanced restrictions on travel to Texas from other states. There's another executive order that I'm announcing today. It's an executive order to make sure that I, as governor, and that we as a state of Texas are doing all we can during this time of disaster to keep the state as safe as possible. So I am issuing an executive order to stop the release of dangerous felons from prisons and jails in Texas. I've heard from law enforcement officials as well as citizens alike who have raised concerns about releases that have already taken place or anticipated releases that could take place of dangerous criminals in jail because of COVID-19. The governor is charged under Chapter 418 of the Government Code to maintain the safety of our state during a time of a declaration of disaster. Releasing dangerous criminals makes the state even less safe. That also complicates and slows our ability to respond to the disaster caused by COVID-19. We want to reduce and contain COVID-19 in jails and in prisons for the benefit of both the inmates as well as the law enforcement officers, the employees, and the staff of those facilities. We've already worked with the Texas Department of Criminal Justice on solutions, and we will work with all local authorities on solutions. But releasing dangerous criminals from jails into the streets is not the right solution. And doing so is now prohibited by law by this declaration. But let me say this. What Texans have done over the past 10 days as a demonstration of the way Texans always respond to challenges. We know that economically and personally, it is an enormous challenge for you to abide by these standards, to stay at home, to slow the spread, to make sure that you are doing your part, to make sure we have a limited expansion and we have maximum containment of the spread of COVID-19 in the state of Texas. You know, we are engaged in a war that threatens your public health and the lives of some of you. The interesting fact about this war, unlike so many other wars, is you have all the tools that you personally need in order for you to personally win this war. You can protect yourself from being a victim of this war by you making sure that you reduce your interaction with others for a period of time to make sure that we will be able to slow the spread of the coronavirus in the state of Texas. You have in your hands that capability to stay home, to stay off the streets, to reduce your communication with others so that you will not be contracted COVID-19. And what we know also is this. This is not the first time that Texas has ever been tested by a challenge. We're tested by challenges almost every year. We're tested by hurricanes, by fires, by storms. And yes, we've been tested by infectious diseases like this in the past, whether it be H1N1 or Ebola or SARS, etc. Regardless of the challenge, Texans have always been up to that challenge. I know that here again, we will be up to that challenge. And I know here again, Texas will lead the way as we work our way out of this challenge and put Texas back onto the pathway of once again becoming the #1 state in the United States for doing business and for economic vitality. But the sooner we're able to get there is going to be dependent upon everything that you continue to do to make sure that you reduce the spread of the coronavirus in Texas. At this time, I'm going to be handing it over. Am I going to you first?
Yes, sir. I think you're going to the court.
All right. And we're going to go to the Army Corps of Engineers first.
Okay.
Please.
Thank you, Governor. I appreciate it for inviting us to participate in this event. And I think I just wanted to take a couple minutes to emphasize some of the things you've already said. One is over the last week, we've worked very closely with the state, with FEMA, with Health and Human Services to create assessment teams that have been going out and looking at facilities that could potentially be used for alternative care sites. That the formation of this team has happened very quickly, and I think it brings the best skill sets from all these different entities together to come up with the best recommendations as we move forward in this. So we are we're basically looking at 3 different types of facilities. There's hospitals that are and clinics that are currently not in use. There are arenas and convention centers, and there's also hotels that could be converted potentially into alternative care sites that could either be used for COVID positive patients, non-COVID positive patients, acute care need patients, and non-acute care needs patients. So as the situation develops, we'll be able to adapt these facilities should it become necessary if the current hospital capabilities are exceeded. So our assessments thus far have been focused in the DFW area with 4 specific locations to include the Kay Bailey Hutchinson Convention Center, which looks like it could be rapidly, should that need become necessary, expanded to as much as 1,400 beds capacity. Looking forward, we do have assessment teams that are available to continue to do these types of assessments throughout the state, and as it becomes necessary, we look forward working with the state, with FEMA, with Health and Human Services to continue to provide this service to the state. That's all I have, Governor. Thank you.
Well, I want to personally thank you and your team for your effort. It's been amazing because we only began talking about this not too long ago. And candidly, your response time, your ability to turn this around to get it up to where it is today has been remarkable in its speed and its efficiency. And it shows how quickly we will be able to respond, whether it be in Dallas or elsewhere, to make sure that the needs of Texans are met. So thank you and your team for the quick response. And now for General Norris of the Texas National Guard.
Yes, sir. Thank you. Governor Abbott and community leaders have asked us to join the team effort with our emergency responders throughout the state to assist in the response to COVID-19. Therefore, you will begin to see personnel in your communities as we deploy to bring aid and assistance and do everything we can to help those in need. At this stage, we are prepared to meet the state's demand in any capacity as we adapt to daily changes in need. We have currently deployed 3 joint task force brigades, as Governor Abbott mentioned, and we're overseeing 10 general support units throughout the state of Texas. In addition, our engineer assessment teams are working hand in hand with the Corps of Engineers and our emergency partners. At present, we have been tasked with 3 primary missions: providing personnel and equipment to support control and logistics measures, providing communications capabilities for response operations, and providing medical support such as drive-through testing support and acting as a force multiplier for the medical community through expanding hospital capacity and providing equipment as we are able. We recognize that many people are not used to seeing the military personnel in uniform in their communities. However, remember that we are citizen soldiers and airmen. We truly are your neighbors, and we are deeply invested in keeping our friends and fellow Texans safe. This is our home too, and together we will get through this difficult time. We are Texans serving Texas, and together we are Texas strong.
Thank you, General. And next, we will go to Dr. Hellerstedt.
Thank you, Governor Abbott. The plan is very clear. We want to do 2 types of things. We want to increase the availability of hospital beds and all the other medical supplies and equipment that we need to address this problem. But equally important is we must continue the efforts that have been successful so far in social distancing and all the other preventive measures that we have. Both of those things are absolutely essential. I really want to put the emphasis as a physician and a public health official on the preventive part of it, and that's continuing to do the things that you see people doing: social distancing, hand washing, cleanliness, hygiene, and the like. And we should really be proud of each other because we can see the evidence of this success when we walk out and when we drive around and see our communities and how much they've changed and how much they've responded to this challenge. Thank you, Governor.
Thank you, Doctor. And next, someone who has not been at these events before because he's relatively new to this team effort, but someone who is very well known around the Capitol, and that is Dr. John Zerwas. Dr. John Zerwas, until recently, was chair of the House Appropriations Committee, a longtime member of the Texas House of Representatives, but also a private practice physician. working as an anesthesiologist. He has unique knowledge about some of the challenges that we're dealing with, and among other things, some of his core responsibilities that he's working on as we speak is to make sure that we will have an adequate number of doctors and nurses and healthcare facilities in our supply chain to meet the needs of Texans. I would like Dr. Zerwas to provide some comments at this time.
Well, thank you, Governor, and thank you for the opportunity to serve with you all. A week ago, we convened what we call the strike force, and that included myself and Keith Myers and Clint Harp, specifically to look at supply chain as well as hospital capacity. And specifically, the hospital capacity was the thing the governor asked me to head up. I'm very pleased, as the governor said, we've already doubled the number of beds that could be available, and that includes ICU beds as well as ventilators, which are critical equipment to take care of patients. We are continuing to look for additional beds within the walls of the hospital. We know that there are probably as many as 30,000 more licensed beds that could be turned into beds that we could use for COVID patients. But on a hospital-by-hospital basis, we have to determine whether those beds really are suitable to accept the staff that would be necessary to do that. So I'm pleased, Governor, with the pace that we're making, and I believe that we are really in a good place right now, but we're going to be in an even better place in the next few weeks.
Thank you, Doctor. And now for Nim Kidd, Chief of the Texas Division of Emergency Management.
Thank you, Governor. First, I would like to start by thanking and continuing to praise our first responders and healthcare workers that are out there on the front line taking care of all patients, not just the COVID-19 patients. Second is to thank those state agencies that are not represented here that are wrapping and rallying to support supply chain logistics and distribution. And third, to thank our federal partners in the work of FEMA, the Department of Homeland Security, the Corps of Engineers, and Health and Human Services. This truly is a unified and a team effort as we move forward. And while the supply chain has been damaged, it is slowly starting to rebuild. Every day we are getting small amounts of personal protective equipment in. We will be distributing them within 24 hours. They will be going to various locations across the state. The method and model for that distribution is based on bed count with a small blend of where outbreak is. Our goal is to make sure that the right PPE is in the right hands at the right time. Also, lastly, again, one more thanks to FEMA and our federal partners. The pictures that you see behind us of the federal medical station that are ready to be deployed are but a small fraction of the resources that we believe we'll continue to get from them. Thank you, Governor.
Thank you, Nim. Before we go to questions, I have been informed that as I was talking about the number of people tested and some other numbers, that during that time period, the feed was going in and out. So let me take just a moment to make sure everybody who is viewing this once again knows the numbers of testing and bed availability. Testing in the state of Texas for COVID-19 has increased about 1,000% over the past week. Bottom line is we are increasing testing dramatically. As of earlier today, the number of people in Texas who have been tested for COVID-19 is 25,483. The number of people who tested positive for having COVID-19 is just about 10% of that, 2,552. The number of counties in the state of Texas where there is a person who's tested positive for COVID-19 is 118. The number of confirmed patients in hospitals for COVID-19 is 176. And there are 34 fatalities that have a connection to COVID-19. Important information for you to know, and that is about less or around 10% of the people who are tested for COVID-19 test positive. That means that about 90% of the people who are tested for COVID-19 test negative, which means they are shown that they do not have COVID-19. A similar percentage, about 10% of the people who test positive need to go to the hospital for treatment, which means about 90% of the people who test positive for COVID-19 do not need to go to the hospital for treatment. And most of these numbers were the result of personal interactions before the distancing practices that began either earlier this week or late last week. Quickly, some numbers about hospital capacity, which is our top priority right now. The number of hospital beds available for COVID-19 patients more than doubled during the last week. As of March the 18th, we identified about 8,100 beds that were available. As of March the 26th, we identified more than 16,000 beds that were available for COVID-19 patients. That does not include the numbers that Dr. Zerwas talked about identifying earlier that may be available on short notice. Most of the new capacity that we're talking about came online after the executive order was issued to end elective surgeries in Texas. And that capacity that I'm talking about, the numbers that I just gave you, does not include the potential for increased occupancy of rooms by doubling the number of beds in a room, meaning that the number of available room beds should continue to increase as we go forward. Importantly, if you just want to look at the numbers, the number of Texans hospitalized who have a connection with COVID-19 is about 2% of available hospital room capacity. Stated otherwise, as of today, we have a COVID hospital vacancy rate of about 98%. Our goal is to help you understand that where we are today, we have the capacity to deal with today's needs to respond to COVID-19. But the key part of our presentation and the reason why we are opening up the facility at the Kay Bailey Hutchinson Convention Center in Dallas is because our goal is to focus on where we may be 1, 2, or 3 weeks from now in the event that we have overflow needs from our hospitals at the local level. And importantly, just to make sure everyone heard this, and that is today we are announcing the opening of the facility at Kay Bailey Hutchinson Convention Center in Dallas. We continue to work with other communities across the entire state of Texas to make sure their needs are also being met. Now we'll be happy to take your questions.
General Owen, there are homeless people sheltered now at Kay Bailey Hutchinson Convention Center. Would there be a time when both they and COVID patients will be there and that pose a problem?
I think that's very feasible, and I don't think that's a problem. I think that there's plenty of space at the Kay Bailey Hutchinson Convention Center where you can partition those patients effectively to not have any conflict between those two groups.
Can you mention any other locations in DFW you're looking at?
We did. We conducted assessments of the Walnut Hill Medical Center, which is off of 75, and then we also conducted an assessment of the Embassy Suites on Stevens, and we also conducted the Lumen Hotel. Looked at the Lumen Hotel in the area too.
Governor, at what point will you reconsider addition of staff and board for the entire state?
Sure. Understand that my future decision will be based upon the same analysis as my prior decision. If you recall, it was more than a week ago where I issued an executive order establishing the standard for the entire state of Texas to close all bars and restaurants, keeping restaurants open for delivery, but also closing all schools in the state of Texas, reducing, if not eliminating, any type of entry into senior living facilities, but also limiting any type of gathering of more than 10 people. Know this, that standard wasn't one that was drawn out of a hat. That was a standard based upon conversations with Dr. Hellerstedt, as well as it was based almost word for word on the standard that was issued by the White House Strike Force team in response to COVID-19. And that was in consultation with Dr. Birx, with whom, by the way, as a governor, I have the opportunity to have telephone conferences with once or at least once, sometimes twice a week, where we get updates. That said, it's my understanding that the White House will be issuing an update maybe early this week. We are waiting to see what, if anything, they announce. And then our analysis in the state of Texas will be based in part on what the CDC announces, what the President's Strike Force team in response to coronavirus announces, and then in consultation with Dr. Hellerstedt. But just know that we constantly monitor this. We're ready and flexible to take any action that may be needed to make sure that Texans remain safe.
Have you considered mandating schools closed for the remainder of the semester, and do you have that authority?
I do have the authority to ensure that schools remain closed for the remainder of the calendar year or of the school year. However, so what we're doing right now is this week I will be meeting with Mike Morath, the commissioner of the Texas Education Agency, and talk with him about his assessment of what needs to be done with regard to school closures. and then I will make a decision based upon consultation with Dr. Hellerstedt.
Governor, Mexican state governors, have you heard from them that they want to restrict Americans coming, crossing into Mexico via the Texas border, and if so, are you going to stop that flow?
Well, let me tell you my understanding. My understanding is that when there was an agreement between the United States and Mexico, which was similar to the agreement between the United States and Canada, it was intended to basically eliminate all non-essential travel across either of the two borders. It's my understanding that commercial travel was continued to be allowed, and certain types of essential travel would be continued to be allowed, but with the same standard going both ways, meaning that the travel limitations on those coming from Mexico also apply to travel limitations of those going from Texas into Mexico.
So there's no need for you to act.
So when we're dealing with international travel, that the ability to constrain that and act upon that is established by the federal government.
Does the state have any idea of the total count of ventilators in hospitals across the state?
Would you repeat it, please?
Does the state have any idea of the total number of ventilators available across the state?
We are continuing to aggregate all the information about the number of ventilators and their location to make sure we will have adequate supplies. We're also working aggressively to add to the supply that we have, knowing this, and that is we don't know right now how many ventilators we will need. We do know we have enough for our current needs, but our goal is to make sure we're prepared for what our needs may be 2 or 3 or 4 weeks from now. And as a result, we're working to look across the country and across the globe to make sure we can add to our ventilator capacity. But we wouldn't do a few more. They need to make sure that we need Texans to know what we're talking about.
Governor, you're being bombarded by businesses, different types of businesses that want to have their employees be deemed essential. I've seen some of the letters, and that's probably just a fraction of them. Is that a factor in you not going to a statewide shelter in place? In other words, you don't want to be picking winners and losers?
My decision with regard to the standard established by the state of Texas as an entity is based upon the advice and the instructions by the CDC, by Dr. Deborah Birx in consultation with Dr. Hellerstedt about what is appropriate for the state as a whole for the best interest of public health and safety. And then we have seen there have been counties and cities that have enacted stricter standards. And know this, as we gather today, about 75% of the state of Texas is under the umbrella of what would be categorized as a stay-at-home policy. And one thing that we are awaiting to see is what is going to come out of the White House later on this week, where the governors have received a letter from the president after our telephone conference with the president on this last Thursday to expect some announcement this coming week about an alteration in the standard. So there's like first things first. The first next thing that will happen with regard to what I will be doing as governor is awaiting to hear what the president and what the White House Strike Force and what the CDC will be announcing as what, if any, alteration is going to be made with regard to the federal standards. And then for Texas to take that information, for me to talk with Dr. Hellerstedt and make a decision that is best for Texas.
So you're letting science and medicine drive the decision, not an aversion to dictating which businesses come with.
This is all driven by science, data, and medical assessments.
Governor, should a grace period for all renters or those with home mortgages be enacted statewide?
You know, things like that are being looked at. Here's one thing that we're continuing to look at and assess as we speak. We're looking at all of these federal dollars and programs that have come down from Washington, D.C. in the bill that was signed into law by the president on Friday. And we need to evaluate all the economic programs that are available. And we are working through economic strategies or business and finance strategies to figure out what the best solutions are for people in the state of Texas.
Do you think it's reasonable for businesses to think that reopening to at least for a day is possible?
It's hard to assess right now. I think the important thing for state leaders is to make sure that we do base our decisions on the best advice of the medical professionals about the dangers that exist out there. The worst case scenario would be this, and that is for us to open up businesses in 2 weeks only to have to shut them down a week later because of a massive increase in the contraction rate of COVID-19. So we need to see something. Let me tell you this for people to think about, and that is we have a certain level of transmission rate for transmission of the coronavirus right now. Because of the vacant streets and vacant stores and vacant schools, there is the possibility that the transmission rate could decrease because there's fewer people to be able to transmit it to. Let us get a hold of the data and of the medical conditions on the ground before we make these decisions.
Governor, Dr. Girowas, I'm told a doctor at Seton Harker Heights said it's about to get real. Just spoke to head of ER at Harker Heights away, but people started yesterday. Scott and White full. We are almost full. They're worried that Fort Hood may be full of cases. We get any concerns about the Monroe County area.
Let me defer that to Dr. Hellerstadt, the commissioner. He probably would have a better angle on that.
At present, I don't have any data indicating that that's a hot spot.
Great. Listen, thank you all very much.